Hello everyone. I hope you all are doing good. Today I am going to start with techniques of obturation. First one is called lateral compaction technique, which is a single cone obturation technique. This has been one of the most common practiced obturation technique. It uses gutta-percha points and a separator to compact the material laterally inside the canal. What are the steps of cold lateral compaction technique? First, dry the canal. Use paper points to completely dry the prepared root canal. Then select the master cone. Choose a gutta-percha cone matching the master apical file size with proper tug back. Now, what is tug back? Tug back is the slight resistance when removing the master gutta-percha cone from the root canal. It indicates that the cone is fitting properly at the apical portion of the canal. Then apply sealer. Coat the canal walls or master cone with root canal sealers. Insert master cone. Place the master cone to full working length. Use separator. Insert a finger separator beside the master cone to create space. Then place accessory cones. Insert accessory gutta-percha cones into the created space. Then continue spreading and adding the accessory cone until the canal is densely filled. Then remove the excess gutta-percha at canal orifices using heated instrument. Then compact the coronal portion gently with plugger. It is a simple and most widely used method. It is inexpensive and easy to learn. If the radiographic verification of the master cone fit is inadequate, that means it is beyond the apex. The tip should be cut off so that the reinserted primary cone fits snugly at the working length, or the next larger size gutta-percha cone is inserted and verified radiographically. If it is short of the apex, then patency has to be established to correct the length, followed by sequential irrigation, then recapitulation. It means it should be free from debris, and shaping of the canal to the master apical file size. Another primary gutta-percha cone is fitted to corrected working length for radiographic verification. Its limitation is the presence of voids in between the filling and increased sealer gutta-percha ratio when compared with the thermoplasticized technique. Studies have shown that warm compaction technique have better ability to seal intracanal defect and lateral canal than cold lateral compaction. In single cone obturation technique, only one master gutta-percha cone is used to obturate the canal along with sealer without any accessory cones or lateral compaction. Next one is warm compaction method, warm gutta-percha. In this warm vertical compaction, the principle is warm gutta-percha technique of filling root canal was introduced by Schilder with the objective of filling the main root canal as well as a lateral and accessory canal using heated pluggers. One applies pressure in a vertical direction to the heat, soften gutta-percha and thereby cause it to flow to fill the entire lumen of the canal. It is indicated when the fitting of the conventional master cone to the apical portion of the canal is impossible, as when there is ledge formation, perforation or canal curvatures, internal resorption or lateral canals. Large lateral canals. It is the modification of cold lateral compaction technique. Its step is clean and shape the canal, then dry the canal with paper point, then select the master cone with plug bag, then apply sealer, insert master cone to the working length. Use heat carrier such as root canal plugger is heated to the redness and is immediately pushed into 3 to 4 mm of the corner third of the gutta percha. The heat carrier is deactivated and removed after pause of 2 to 3 seconds inside the canal. Then the excess gutta percha is removed. Then a vertically prefitted condenser or a plugger of a suitable size is inserted and vertical pressure is applied to the heated gutta percha to force the plasticized material apically. Then the heat carrier is now again activated and placed to the further distance of 3 to 4 mm into the remaining gutta percha. This is again followed by pausing and removing another segment of gutta percha, followed by compaction of the remaining gutta percha with next narrower size plugger as we proceed apically. This process of downpacking is repeated until the smallest plugger compacts the gutta percha to about 5 mm distance from the working length. Care should be taken to not remove the apical 5 mm of gutta percha during the downpacking procedure. Once the downpacking is completed, the next step is to fill the remaining canal with thermoplasticized gutta percha. Shielder technique is the remaining portion of the canal is plugged with additional pieces of gutta percha that is heated with a heat carrier and then compacted with appropriate size plugger. In thermoplastic backfill technique, heated gutta percha to a specific temperature and allow the operator to extrude the thermoplastic gutta percha into the canal apicocoronally. Once you fill 3 mm of the canal, the backfill device is removed and the plugger is used to compact the gutta percha. This is repeated till you complete obturate the canal till the canal orifices. Its advantage is excellent seal of the canal apically and laterally, obturation of the larger lateral and accessory canals. Its disadvantage is it takes a lot of time. There is a risk of vertical root fracture. Next one is warm lateral compaction technique, where the heated gutta percha is laterally compacted inside the root canal using heated spreader and accessory cones. Next one is continuous wave compaction technique, where a heated plugger continuously softens and compacts gutta percha apically in one continuous movement to create a dense three-dimensional seal. Next one is the thermoplasticized gutta percha injection technique. This technique comprises a pressure apparatus consisting of an insulator electrically heated syringe barrel and a selection of a needle ranging from 18 to 25 gauge size. The plugger is designed to prevent backward flow of the gutta percha. In this technique, gutta percha is heated until soft or flowable, then injected or carried into the root canal system for three-dimensional filling. One is carrier-based gutta percha technique. In this technique, gutta percha is softened and is coated around a central carrier and inserted into a prepared root canal. In this, the carrier helps deliver heated gutta percha uniformly into the canal for three-dimensional seal. Next one is max pattern thermomechanical compaction method. It uses heat to decrease gutta percha viscosity and increase its plasticity. The heat is created by rotating a compacting instrument in a slow speed quadrangle handpiece RPM alongside gutta-percha cones inside the root canal. In this technique, where a rotating compactor soften gutta-percha by frictional heat and compact it inside the root canal. It was introduced by John T. McSpadden. A reverse H headstrom-like rotating instrument called McSpan compactor generate frictional heat which plasticize gutta-percha and force it apically and laterally.